one I'm going to show you is going to be the radial splint. Okay, I'm going to use your other arm because that one has a watch on it. So just turn it. All right, so Walt, come over here. So Walt is going to be my partner. So I'm coming up and I'm exposing this area, and this, no, you're fine. This is where her break is going to be at. So I want Walt to come up, and don't stand in the way of the camera there, but you're going to hold this manual stabilization, okay? So first I'm going to come in and check her PMS. So do I feel her pulse? Can I feel you squeezing my hand? Can you feel me touching you? Now, because the break is right here in the middle of the bone, I need to secure the joint above and below. So that's going to be from the elbow down to the wrist. Now, I need to choose an appropriately sized splint, okay? So even though this one here would go that length, we don't need it to be this long. So an appropriately sized splint for this particular area would be about this size. Now remember, I told you guys that the padded side needs to go to the skin. So the back side of this is wood. This padded side is what needs to be against her skin, okay? So he's holding manual stabilization. I've checked her PMS. I'm gonna put this underneath. Now Walt's just gonna grab onto the board. So he's still gonna keep holding it, but he's gonna hold the board there as well. Now her hand is kind of dangling off the edge here. I need to put something in her hand, and this is called splinting it in a position of function, okay? Because if her fingers are dangling off, this could cause these muscles here to pull. So by putting something like this roller gauze in her hand, that's resting it in a position of function, and is gonna cause this area to be more relaxed. Okay, so we're gonna just put that there for right now. Now, I'm gonna come in with another roller gauze. And if this was an open wound, so if this was an open fracture right here, I could go ahead and put this gauze over top. But if it's closed, like we'll say it is now, then all I need to do is use the roller gauze. Now remember, I'm gonna start from down here and roll upwards because I don't want any blood trapping down in her hand. Okay, so I'm gonna start down and work my way up when I'm rolling the gauze. Now I want to leave room for me to be able to come in and check her distal pulse. So I don't want this to be too tight, and ideally I don't want it to be directly over that site. So even though her hand is resting here, I want it to be secured at the joint, which is the wrist, but I want to be able to get in there and check her radial pulse too. So I'm just going to roll this. It doesn't have to be super tight. I'm just rolling it around, and I'm going to go all the way up to the elbow, okay? Now, if I were to go all the way up and I still have some gauze left over, then I can make my way back down if I wanted to as well. So it's just whatever you feel like is gonna make this the most secure. And then I could either tuck this in or tape it, okay? Now, I'm gonna come back and check my PMS again. So I'm gonna check her pulse. I'm gonna ask her again, can you squeeze my finger? Can you feel me touching you? And now I'm done with this here, okay? So this is one of the most simple, but also one of the most effective splints for this area. So this would be good if it was the wrist or if it was the forearm, because if it was the wrist that was injured, we're still immobilizing all the way down to the hand. If I wanted to start my gauze wrap around the hand, then I could do that as well. But remember, you want to go in there, you want to have room to get in there for that radial pulse. Okay? So I'm going to take this off. We'll talk about what would happen if it was the humerus. It would not be very good. All right, so if this was her humerus, either one, it doesn't matter. You don't have to expose it. Just better show the truth. If it was her humerus that's broken here, then remember, I've got to secure everything in the whole shoulder girdle. So her clavicle, her scapula, all of this has got to be secure. Now, a couple of ways that I could do that. If she feels comfortable in bending her arm, then I could just do this sling and swath, and then I can tie this down, which I'm going to show you how to do. But if I felt like I needed to secure the bone even more, then I could use these two and kind of sandwich this area and tie them with these triangle bandages and then do this sling and swath. But probably the most comfortable for the patient is just simply going to be that sling and swath. Okay. So
if you were doing both, Brittany, both splints, how would you secure it? Would you wrap it around her body to secure them, or?
So if I was putting just these two on, then I would just secure these to her arm. So I would come in with this and tie these down.
Okay.
And I'm going to show you some more techniques and how to use the two boards in just a second. Okay. So if I was just using this linen swath, and even if I had just done that radial splint and she felt more comfortable with having it in a sling and swath, then we could do that. So basically you'll take this triangle bandage and unfold it right here at the most pointy area of the triangle. You'll just kind of pull in some of it and tie a loose knot. And then that's going to create a little bit of a sling, okay, for her arm to sit into. And so bend your arm for me. I would just put this around the elbow. And we would secure this up here. Now, if this was uncomfortable on her neck, we could put some padding underneath the knot. But again, same thing. I would want to check my PMS before and after I'm doing any type of manipulation here. Now, the biggest piece of this that we are going to be securing it to her arm, I mean to the rest of her body, there's one of two ways that we can do it. She's pretty small, so I could take this and put it around the outside and tie it on the outside of this arm, but probably the best option to give her some range of motion on this side still would be to lift this arm and tie it down to the side of her body, okay? Now, could she move it if she really wanted to? Yes. All right, this is simply to remind her not to move it and provide a little bit of support in holding this arm up.
So it's pretty much a C-collar for your arm.
Right, that's gonna limit this movement to prevent further additional injury to this bone and holding still that clavicle and scapula as well. Okay, so I would check the PMS before and after again.
So on the swath, I know we can't see where the break is, but we, judging by their radiation of pain, we know where to put that. So you're not putting it like right on top of the break.
Well, with this, it's just gonna be more supporting the elbow. So are you talking about tying this side?
Yeah.
Right, yeah. It doesn't, again, you don't want it to be so tight that it would be causing additional pain to that area, but just enough to remind her I shouldn't be moving my arm, okay? Now, while she's standing, I'm gonna go ahead and show you how to do the bent elbow, okay? So we'll just get all of our upper extremity stuff out of the way. Now, when you're talking about the bent extremity, you do need a little bit bigger of boards. Because even though these small boards might work for Rachel because she's fairly small, you want to get in the habit of having enough room to really secure these. So there is a size that is between these two, but just for demonstration purposes and having enough room, I'm going to use these here today. All right, but you don't want these to be too big that your patient isn't able to manipulate them. All right, so if she has an elbow injury, so we kind of talked about these, whether this is a fracture to the elbow, if it's a dislocation, any type of injury where she feels most comfortable in having this bent, then I'm gonna splint it in that position. So the way that Walt would come up and hold manual stabilization is of these two bones, okay? So Walt's gonna come in and hold that manual stabilization, and I'm gonna check her PMS, all right? So again, I'm gonna check her pulse. Can you squeeze my fingers? Can you feel me touching you? And I'm looking at this extremity. Again, if there is anything that is open, then that's, we could cover it. But most likely if it's the elbow, it's gonna be closed. Now I need at least 3 triangle bandages to do this and my appropriately sized splints, all right? So the first triangle bandage, I'm gonna come in and I'm gonna tie this on her arm like this. So I'm gonna put it on and I'm gonna loosely tie this on the outside of the elbow, okay? And I'm just gonna let it hang there. So I'm not tying it super tight, it's just kind of resting right there. And then I'm gonna come in with these 2 boards. And so remember, because it is the joint, we're securing the bones above and below. So that's what's actually gonna be in contact with the boards, and the elbow itself is gonna stay exposed. We're supporting the bones above and below, okay? So padded side to the patient, I'm gonna kind of sandwich these and put one underneath, and I'm gonna put one on top. And now Walt's gonna hold on to those, okay? So for this, you really want her hands to be out. So we want this to be bent just a little bit more where her hands should be out. It shouldn't be resting on this board, okay? So the hands should be out, the elbow should be out, and the bones should be sandwiched, okay? Because it's not this bone, so that's why this doesn't have to be in a position of function anymore. Okay, so hand exposed, elbows exposed, and he's holding those on there. Now this is sometimes what can get tricky for people, and this is why I wanted to have a big enough board to show you. When you come in on the distal ends of these boards, you're gonna tie this in what we call a figure 8, okay? So I'm gonna put this up top, I'm gonna bring them in between here and cross them, and then I'm gonna come to the bottom. Now you have a couple of options. You could tie this down here, or you can bring it back up around and tie it on top of the board. Now, I don't want to yank this down and cause a lot of gross movement of her arm, because if I were to do that, then you can see how much it manipulates those boards. So I don't want to do that. I want to be kind of gentle, and I don't want it to be as tight as it can be just yet, but I do want it to be close to her skin. All right, so I'm not going to tie this, knot it all the way up. I'm just going to leave it like that for a second. Then I'm going to come through, and I'm going to do the same thing on the back side. So I'm going to put the triangle bandage. I'm going to do the figure 8 underneath. I'm going to put it under the bottom, and I'm going to pull it back up to the top. And again, same thing. I'm not jerking it. I want it to be close to her skin. And I'm going to tie it. But this time I'm going to tie pretty tight. Okay? And now you can double knot it, but my advice would be to do a bow, because if you need to loosen it back up, the bow is going to allow you to do that. So now I have this one secured. I'm going to come back to this one. I'm going to tie it tight. I'm going to do the bow. And now this leaves this one in the middle. Now this one in the middle, still keep holding. This one in the middle, I left exposed. I'm going to untie it from where I have these two pieces tied together. And I'm going to now bring them on this side. So this middle piece right here actually has no contact with her skin and is only supporting the boards. Okay? That's what's keeping the tension on these boards, because if I didn't have this piece here, I could just slide this whole thing right off. But keeping this piece right here and keeping the boards together is what's providing that stabilization. Now I'm going to tie this on the top board up here. I never want to tie it onto the patient's skin. All right, so I'm going to put this bow, and then I'm going to come back and I'm going to check her PMS again. So I'm feeling her pulse. Can you squeeze my fingers? Can you feel me touching you? I'm looking at her skin color, temp, and condition. And then I'm going to ask her, do you feel like you're able to hold this? Again, if I had a little bit smaller boards, I could do the sling and swath if I needed to. Or you could like place a pillow underneath this while they're sitting on the stretcher. Whatever you feel is going to be the most comfortable for them. Okay, so that's the bent elbow. Anybody have any questions on that?
Are you gonna put something in her hand on this one like you did the other one?
No, because remember I said this isn't this bone.
Okay.
We wanted to limit movement of this bone because it was the bone that was injured.
Okay.
All right, so this time, because it's the elbow, even though we've secured that bone, the hand itself doesn't matter if
Well, what
it
if they injured both of them?
then you wouldn't be able to use this splint, because exactly what I said earlier, this would be compressing this. So if you had a patient that had a forearm injury and you tried to use this splint, that's going to worsen that, because the pressure on this bone right here is going to make that much worse. So your patient's going to complain of worsening pain. Their vital signs are probably going to escalate as far as heart rate and respirations with the anxiety and the pain. So that should let you know that that was an inappropriate event. If you have the entire arm that is injured, then you can splint the entire arm using both of these boards like this. So if it was all of these bones, everything is broken, and you need to stabilize the entire arm, he would come in and hold manual stabilization of the entire arm. I would check my PMS, padded side of the board. I'm going to put one underneath all the way up to her armpit. Now this one's going to be a little longer. Hold that on there. I'm going to put this one on top. And then I would come in and secure these. And then I can recheck her PMS. But again, if it's the humerus that's involved, I would still need to tie this down just like we did before, so that she doesn't have any movement of that shoulder. Does that make sense? All right. All right, so once we get this off, then you can go ahead and lay down. We'll talk about some leg splints. All right, so as far as the leg, if this was her tibia and fibula that we think are broken here, and it's just isolated to this area, so the femur is not involved. If it's these bones, then I need to secure the joints above and below, which is gonna be the knee all the way down to the ankle and the foot. And so that can be a little bit tricky in itself to try to isolate. So you're kind of looking and identifying how long is this area. Do I need to use something that's longer than this? This is just a little bit short of her knee. So again, if I had something in between these sizes, it would be ideal. But if I don't, then I can use this one. So I'm gonna have Walt come in, just come down to the bottom, see if you can hold from down there. So he's gonna come in, and you wanna hold manual stabilization by putting your hands above and below where you anticipate the wound would be. Now obviously we would cut this and expose the wound. She wouldn't have a shoe on because we need to be able to completely assess everything and be able to check the distal pulse as well. And so we can do that at the posterior tibial site back here behind the ankle, or we could use the pedal pulse on the top of the foot, okay? So what I'm gonna do for this site is go ahead and I'm gonna slide these triangle bandages in. I'm gonna go underneath her knee because that's automatically raised a little bit off of the ground, not making complete contact with the ground. And so I can kind of put these in and then shimmy them down her leg, so I'm not having to have a lot of gross movement of the leg itself. All right, so I'm just gonna put 2 of these under there for right now. And then I'm gonna slide these boards, padded side of the board, down here next to her leg. And now I can tie these up, okay? So remember, we never want to tie this onto her skin, so this should come all the way down to the outside of the leg, or the outside of the board rather. And this again should not be like impeding her circulation or anything like that. So if we notice it is, then we need to go back and address it and potentially loosen it. Now remember, we said we need to secure the joint. Now she could still move her foot and her ankle in this case, and so that's not completely securing that joint there. So the best way to do that is going to be to come in with this triangle bandage, put it underneath her foot, and kind of wrap it underneath. All right, and then tie this down to the board. All right, and so by doing it like this, now she's not gonna be able to have as much flexibility of that foot. Truthfully, she could move it if she wanted to, if she tried hard, but it's gonna prevent some of that gross movement and remind her not to do it. And then I would come back in and check my PMS again. Can you push against my hand? Can you pull back towards you? Can you feel me touching you? Okay?
Well,
You, go ahead.
If you don't want to move her foot, then why would you ask her to press against it and pull against it?
Because you're checking her motor function. So even though you don't want her to completely flex her foot down, but just wiggling her toes or pushing a little bit against your hand, that could, you gotta check her motor function and make sure it's still good. All right, so same thing, you could do this all the way up, and it's pretty much demonstrated with the length of this splint that if this was the femur involved as well, if she was not a candidate for the traction splint, you could still do this. This length of splint would really work for her all the way up to the femur as well. I would likely put one more triangle bandage up here at the top if I was trying to isolate the femur as well.
And what if there was an instance where, like the knee was dislocated or something, you need to keep it bent?
I'm gonna show you
Same
that.
principle. Oh, okay.
All right, you're getting ahead of the game, Joe. All right, so we take this off. There we go. And so let's look at the bent knee. So just bend your knee up like that, yep. So Walt would come in, and he's gonna hold manual stabilization. So again, this is the knee that's injured. It's dislocated, it's fractured. She's not able to straighten it out. It's extremely painful. This is what's most comfortable for her. So he's gonna hold this above and below the injury site. So he's gonna hold that manual stabilization. And I'm gonna do my PMS assessment. So I'm checking back here. She wouldn't have a shoe on, so I'm checking back here for her pulse. Can you push, can you pull, or can you wiggle your toes? Do you feel me touching you? And then I'm gonna come in, and just like I did with the elbow, I'm gonna put this first triangle bandage underneath. And I'm just gonna tie it really loosely, and I'm gonna let it hang from the top to the bottom, just like this. Then, with this splint, I'm gonna put the padded side, I'm gonna put one on one side of her leg, and I'm gonna put one on the other side of her leg, just sandwiched like we did with the elbow, and Walt's gonna hold those there, but make sure you're holding them right in the middle, right up against her leg. And I'm gonna come back with my other triangle bandages, and just like I did on the elbow, I'm gonna do the figure 8 splinting here, okay? So I'm gonna put this on the outside, I'm gonna bring them into the middle and cross over. And then I could tie them here, or I could come back around, whatever you wanna do. I'm gonna push this down close to her skin, and then I don't want this to be as tight as possible, but I am gonna tie it relatively tight. I'm gonna come back down here with the second one. I'm gonna put it on the outside. I'm gonna cross it over. I'm gonna bring these back to this side, push them down close to her skin, and this one I'm gonna tie pretty tight. Okay, so I'm doing it smoothly, I'm not jerking it, causing a lot of additional motion of the bones. I'm gonna come back to this one, tighten it up, tie it, and then just like I did with the elbow for the knee, I'm gonna pick up these loose threads, I'm gonna untie it from right here. I need to pull this underneath her knee, because that's what's gonna hold these boards together and give some support. And then I'm gonna tie it on this side. All right? And then I'm gonna come back down, I'm gonna check her pulse, I'm gonna check her motor function, sensation, and then I've got to figure out something, because either A, if we did this en route to the hospital and she's already on the stretcher, then really all I need to do is ask her, are you comfortable holding this like this, or would I be better to put a pillow over to the side of the stretcher rail and let her lay her leg over? Is that more comfortable for her? Now, if we did this on the ground and we had to get her onto the stretcher, then it might take a little bit more additional. Okay, your leg is injured. You're not going to be able to bear weight on it, okay? So you would be moving her to the stretcher, so you would need somebody to hold onto this leg and offer some support to it while you were putting them onto the stretcher, okay? Everybody good with that? All right. And then the last piece of this is going to be the traction splint. And so remember that with the traction splint, we're really isolated into the time that we can use the traction splint, because it has to be where the leg is, the fracture is mid-shaft of the femur, it's closed, there's no injury to the hip, to the knee, to the lower leg, to the ankle, or to the other leg, because we have to be able to measure it against the good leg. So if there's any injury to any other portion or to the good leg, then she would not be a candidate, or if this was open. All right, so really limited here. So what we would do in this case, lay back for me, is she's gonna be in an excruciating amount of pain, all right? And so that's gonna be kind of a key factor in what we're doing. So as I come up and I'm assessing what's happening here, and I'm kind of looking, I'm out looking to see, is there any shortening of this limb? Is there any rotation of this limb? I'm assessing for those other injuries. I would have exposed the leg, removed her shoe, so that we could really make sure that there's no other injury, all right? Now, once I've identified that this is, in fact, the femur fracture, that I'm going to treat this with a traction splint, I'm gonna have my partner come up. And I'm gonna check and feel my PMS before we get started. So I'm gonna check her pulse. Can you push? Can you pull? Can you feel me touching you? But I need to reassess that again in just a second. So especially if I see a shortening here is really where we'll tell the difference. So Walt is gonna come up and he's gonna hold her traction on this, and he's gonna have to pull hard to realign this bone. So he's gonna put one hand underneath, just like this, and one hand on the top of her foot like that, and he's gonna pull. All right, and so he's gonna pull until she stops screaming, or until she says that feels better. All right, because that's what will happen when you realign those bones. The pain will be a lot better. All right, so he's gonna pull until she feels some kind of relief or stop screaming.
You
What
do
if
this
she's
as a
passed
slow,
out?
steady pull, or
Yes.
not a yank?
All right, yeah, it's gonna be kind of a slow, steady pull, but once he reaches that point, he's got to continue to hold that, and he can't let go. Because if we've realigned these bones, and we don't want these bone fragments to come back and create any additional damage to the area, to the nerves, to the blood vessels, so we don't want any of that. So once he's got it, he needs to continue to hold it. That's very important, okay? So now I'm gonna reassess her PMS and make sure that if it wasn't present, now it is. I'm gonna try to make sure that it's still good if it was good. So we're looking at that, okay? So she's feeling some type of relief. He's gonna hold this here. That's very important that he doesn't move. So now I've got my equipment, which is the traction splint. And so I should have a viable ankle hitch here. That's gonna be good, and I'll use that in just a second. And then I need to make sure that all parts of this traction splint are functional. And then I need to measure it against her good leg. All right, so I'm gonna get up and move over to the other side of her leg. Try to straighten these straps out. Both sides of the strap should have Velcro on it, so if you need to move them, you can. Generally, these are labeled, and so they will be labeled like 4, 3, 2, 1. And so we'll start at 1 and move upward. Now, if they don't have the numbers on them, that's fine. Just remember that we are starting low whenever we're ready to secure these. So this piece right here is actually gonna be the starting point of our measurement. And I'm gonna put this right around the edge of her butt cheek, all right? And then this is gonna go about 6 inches past the end of her foot. Now this is a little bit longer than 6 inches, so I should be able to twist these pieces, and I can shorten it or lengthen it however I need to, all right? So we don't need it to be that long. That's probably good. I'll twist these back to make sure that they're tight. All right? So once those are measured out, I'll bring it back over to the other side. And then a couple of things have got to happen. I'm gonna go ahead and I'm gonna work around walk, and I'm gonna put this ankle hitch on. All right, but when I do that, he can't let go. He still needs to continue to hold this manual traction. I'm working around him, but he can't let go just yet. Okay, slide that right under there. So we're putting the ankle hitch on, but he has not let go of manual traction. Okay? When I bring this over to this side, I'm gonna space it out how I think it should be. And then I need to align my straps. So however I think they need to be, that's how I'm gonna line them up. What I don't want is to put a strap right over the site of the injury. I don't wanna put a strap right over her knee. And I wanna make sure that they're spaced out if possible. Okay, so if her leg is too short to use all 4 of these, that's fine. I'll show you that in just a second. Okay? So I'm gonna put these in, I'm gonna undo them so that we can slide this right under her leg. So now Walt, he's still pulling traction, but he is going to lift her leg. All right, so go ahead and lift it. Enough for me to slide this underneath. There you go. And I'll go right back down. So he's still holding traction. Lift up again, just a second. All right, so this top strap is called the ischial strap, all right? And it's going over her pelvis. So ideally, you want this to come up and over just like this. Now this might be difficult if you have someone who has very large thighs or something like that. So just make sure that it's gonna fit, but you want this to come up and over. So we have the ankle hitch on, we have the ischial strap. Now we're ready to pull traction with the end of this, okay? So go ahead and lift up again. I'm gonna pop this kickstand out. I'm going to bring this over, and I should be able to pull on this and release it. There you go, thank you. So I pulled that pin and released this. Now this is going to hook onto the end of the ankle strap right here. But Walt is still pulling, and he's gonna still pull until I twist this to pull equal traction to what he's pulling, okay? Now once I'm pulling the same traction he was with this, he can let go, all right?
Is that strap how it's supposed to be at the bottom, wrapped around there?
No, it's supposed to just come straight across. I couldn't see over top of his hand. All right, there you go. So if your patient was really here, then you would just need to go back to holding manual stabilization or manual traction if you were pausing to do that. All right, so now I'm gonna start at the bottom, and I'm gonna start 1, 2, 3. Again, not going directly over her knee, but I also don't wanna go directly over the break. So I need to put this up like this. If you didn't have room to do all 4, that's fine, but you want the break to still be exposed, okay? Or the area that you think it is. And then again, come back and check your PMS before you go. Everybody good with that? All right, that's it.